Mic check, Michael. 1, 2, 3, 1, 2, 3, 1, 2, 3.
Testing 1, 2, testing 1, 2, 1, 2.
Welcome to the Tuesday edition of our virtual town hall to answer your coronavirus questions. I just had to question myself. It is Tuesday, right?
Right.
I'm Michael Wooten.
Yeah, we all lose track so easily now. And I'm Mary Alice Demler. We have a lot to get to, including questions about your stimulus payments, how far the virus can actually travel when you cough, and testing that can be done at home. So let's start with the 3 things, though, that you need to know right now.
Yeah, number 1, tough news in 2 parts of our region. Today, Niagara County increased its death toll from the new coronavirus up to 17, and Cattaraugus County reported its first COVID-19 related death.
And number 2, the lieutenant governor is now in charge of this region in terms of eventually reopening the economy. The governor said reopening decisions will be made on a regional basis, and Lieutenant Governor Kathy Hochul will be the point person here.
And number 3, the governor also announcing some good news for people whose elective surgeries have been put on hold for weeks. Hospitals in most counties across the state will be able to resume those procedures in a week. Erie County, though, is not included in that.
And our first question came in shortly after the governor made that announcement about elective surgeries. A viewer asked, how quickly can those surgeries resume? And what about surgeries scheduled in Erie County? Is there a timeline here?
Well, as far as Erie County, no word on when those surgeries will resume here. Health experts say that hospital beds are still needed in Erie County due to the number of COVID patients here. But in our other counties, those procedures should be able to resume pretty quickly after this week's time in which this will take place. I talked today with the leaders at Niagara Falls Memorial, Eastern Niagara, and Catholic Health, which runs Mount St. Mary's in Lewiston. They all agree that they'll be able to get these procedures going pretty quickly.
It will probably be just a day or 2 for us to regroup and be ready to schedule those surgeries again. I've been in contact with our surgeons today and our medical staff to make sure that we've got everything back together. We'll be calling some of our staff back who were furloughed previously. We need them to come back in and assist us. So for us, this was very good news today.
Our team is working through that right now to understand all the different variables there. You need to remember, Michael, that it doesn't just start where we're open tomorrow and you walk in and have your knee done. There's the whole pre-surgical testing. You need to get the patients queued up, make sure they're, which patients are going to see, which patients are the most urgent to be seen, and work closely with our medical leadership, who's been outstanding during this crisis.
We've been preparing for that prior to today, and we've also put in extra precautionary measures so that when we do start, we're making sure that we are keeping our healthcare workers as safe as possible and to make sure it's safe for our patients, obviously, as well.
And at Niagara Falls Memorial Medical Center, they're actually going to test patients 4 days before they have one of these elective surgeries. Just another added layer of safety. So much to this announcement today, Mary Alice. So Leanne Stuck, one of our reporters, is going to have more on all this at 11 o'clock tonight.
Yeah, there's a lot of details that I think everyone will be interested in because there's great disappointment, obviously, that this doesn't apply to Erie County right now. But there is a formula that the governor actually set up that I know Leanne will explain. They want to make sure there's a certain percentage of beds available, and they cannot have more than 10, new patients with COVID-19 coming through the doors. So there is at least a matrix in place so that when things start to get better here, they will allow things like outpatient surgery.
Yeah, all of those hospital executives say in those particular hospitals, they have the capacity to be able to safely do this. That is obviously key. We continue to get asked about stimulus payments from the federal government. A lot of people still waiting. Don and Sue, husband and wife, emailed us this question. They said, "We are seniors. We prepare our tax return for a refund in check form. However, we have our Social Security payments direct deposited into our bank account. How will we receive our stimulus payment? Check because of tax return or direct deposit because of Social Security?"
Well, we asked that specific question to the IRS because other people have asked about similar situations. While we wait for a response, here's what we can tell you. For the most part, the IRS is going off of information from your latest tax return. So you may want to assume for now the IRS plans to send you a paper check.
But that's going to take time, so there is a little bit of a way around that. And this is important information for a lot of people watching right now, because if you want to get your money more quickly and you have a question about whether or not the IRS has your right bank account information, you should go ahead and provide it to the government. And you can see on the side of the screen there, this is the IRS Get My Payment tool. We've been talking about this. You can find a link to it right on irs.gov. If you can, you should go there and go through that process.
Now, the not so good news, a lot of people are using that feature and then it says payment status not available after you put in your information. Now that means that the IRS is still working on it. That's what almost all Social Security recipients are getting right now. I know my mom did when I put in her information with her because the IRS just hasn't gotten to that yet. They ask that you be patient, but maybe periodically go back to the Get My Payment tool and look for updates. I like to remind people, Michael, that, big government is the Titanic. It's not a speedboat. So, coming up with all these new websites and all these new rules and handing out these stimulus checks, it sounds kind of simple, but it's actually a big deal with a lot of moving parts.
Yeah, it reminds me of the unemployment situation in New York State that we've talked about so much. No real new developments on that front today, but it's a similar situation here. You have just so many people with so many specific situations and trying to get through all of them. They're asking people for their patience. That's obviously not something a lot of people have right now.
Very true. Well, we want to go back to a question that we got early on in this pandemic because we now have a better answer. Someone asked us by text, how airborne is this virus? We're told to stay 6 feet away from others, but can your sneezing and coughing spread the virus farther than that? Well, researchers are learning more and more about how the droplets spread, and we wanted to share this with you from NBC News. You may have seen part of this on the Today Show.
Scientists at Florida Atlantic University using a lab to visualize what happens when we cough.
Charging.
The engineering professors use a dummy to simulate the cough droplets we all create.
3, 2, 1.
The FAU team uses a laser to follow how far those droplets travel. What you're looking at is a mixture of water and glycerin that creates smoke, 10 to 20 microns in size, the same size and weight of the smaller droplets of fluid we expel when we cough. The simulation shows the projection. 3 feet traveled in less than 2 seconds. Within 12 seconds.
That's at 6 feet.
And in 41 seconds.
There we go, 9 feet. And that was a cough, would you say?
That was a heavy cough.
In some tests, we saw the cough travel up to 12 feet.
Okay, this is a slight cough.
The scientists say naturally, a lighter cough doesn't travel as far. In every simulation, we observed what the naked eye cannot see.
And that makes me think of what Dr. Thomas Russo from UB has been telling us time and time again, which is this can be spread farther than 6 feet. And now I think that's a big reason why so many of us are wearing masks when you're out in public. Even if you are 6 feet, 9 feet, 12 feet away from people, if you have the mask on, it's going to dramatically shrink the distance that can travel.
Yeah, who would have thought that
Yeah.
a cough or a sneeze could travel quite that far. I
It's
do feel better
crazy to
about
see it.
wearing my mask now that I've seen that.
No doubt. Hey, so you may have seen the news today, pretty big news, that the FDA has now authorized the country's first at-home COVID-19 test. It prompted this question that we got texted to us this afternoon. Somebody said, how soon until I can order one of these at-home tests myself, and will I have to pay for it out of pocket? Well, as far as the cost, eventually it appears some insurance plans may cover that. Still a little bit of unknown, but for more on the time frame and who is eligible to get these tests at first, we get the explanation from NBC Chief Medical Correspondent Dr. John Torres.
Today, the FDA has authorized the first at-home collection kit. Now, one important thing to note, this test will not give you results at home right away. The sample still has to be sent to a lab, and it's the only COVID-19 home test with FDA emergency use authorization approval, so be wary of any scams out there. But this test is a way for people to find out if they're positive for the virus by taking their own nasal swab and then sending it in, instead of going to a drive-through or a hospital. One big benefit of this test is it helps prevent exposing others. Now, before ordering, a physician has to recommend it after you complete an online COVID survey, and it's not yet available in all states. The kit will cost a little over $100 and will be available first to those on the front lines and in the coming weeks to general consumers.
I think those tests are going to be really, really popular, Michael.
Yeah, absolutely. I was reading through the FDA's letter that it sent the manufacturer, and there's a lot of technical, language in there that I didn't fully understand. But there are a lot of questions right now. When are we going to be able to get this? This just happened. So in the coming days, I think we'll have a lot better understanding about how this is going to work. For now, you and I can't get one of these at-home tests, but first responders will be able to, and eventually for us.
Yeah, that's good news.